The Newsday continues here on One News Now. I'm Sean Yao. The OCTA Research Group has noted an uptick in COVID-19 cases in Metro Manila as of late. Let's discuss this further with Professor Guido David, who joins us over the phone. Good afternoon, Professor Guido. What is the current infection rate in the capital, and when was the last time we saw it at this level?
Yes, hi, Sean. Good afternoon. Currently, the reproduction number, which is an indicator for the rate of infection in NCR, it's about 1.06. That means it has risen above 1. And the last time it was greater than 1 was back in April when we were still in ECQ. I think it was around April, yeah. So yeah.
Okay, so having said that, we last saw above 1 in April when we were in ECQ. Do you think it's about time we go back to imposing stricter lockdowns? Should Metro Manila go back to ECQ, basically?
Well, I think it's too early to make that determination at this moment because it has only been maybe a day that we have seen it. So we will monitor the situation closely and we'll look at the trends. And if the numbers continue to increase, because right now we're averaging 700 cases per day, and the last time we were above 700 was about 4 weeks ago. So since 4 weeks ago, we've been averaging less than 700, around 650, and last week around 640 cases per day. So if the numbers continue to escalate, then definitely we will be very concerned, especially with the news that there are local cases of the Delta variant even in Metro Manila.
Right, let's get to Delta in just a bit. For now, I want to ask you what you think drove this uptick in cases. Is it the increased mobility due to east lockdowns?
Actually, it's very difficult to answer that specifically right now, Sean. So it might be the increased mobility. That's a possibility. Some people might think it's the Delta variant, although we're not seeing it yet. But we can't rule that out completely. But most likely it's the increased mobility among people.
Right. So I'm going to go ahead and ask you, what other measures the government should impose in the face of, or the threat of the Delta COVID variant is very much upon us, so to speak?
Yeah, well, definitely one thing we could think about is rolling back the plan to allow 5-year-olds and above to go out. We're not specifically saying we should change that, but at least maybe we can reduce the time. For example, we could have them not being able to go out every day, but perhaps maybe 2 days a week or 3 days a week. So at least we can reduce the time spent outdoors. And also we could consider maybe increasing restrictions just a little bit, reducing capacities in establishments. So these are some of the things that we can discuss. We're not talking about ECQ, of course. We're talking about GCQ, but perhaps with some restrictions. These can be scaled back because of the threat of the Delta variant. We don't know when it will spread in the region, and that's why we have to be prepared. Another thing that was discussed was imposing a bubble around NCR Plus. I think it has been thrown around, that idea has been thrown about, but I'm not sure if the Department of Health was, I think they were not so keen on that specific idea.
All right, over the last couple of weeks, we've also seen a lot of vaccines arrive here in the Philippines, a lot of supply now. Do you think that given our current pace of vaccination, which has improved in the past week, that we will be able to achieve our target of population protection by the end of the year?
Yeah, I think we should be able to do that, Sean. And specifically, we're also looking at getting to at least about 20% fully vaccinated. And we're actually close to that in the NCR. We hope that they can continue to prioritize the NCR. Doesn't mean that all the vaccines have to be given to the NCR, but at least give priority, especially with the threat of the Delta variant, because if a surge happens in the NCR, I mean, it will really affect the economy, affect everyone, and that's why having this bit of protection for our people in the NCR will be a great help in mitigating the spread of the Delta variant.
Right, so most of our confirmed Delta cases are actually outside Metro Manila, mostly in Region 6 and Region 10. Can you tell us, Guido, which areas outside the Metro are also seeing an uptick in COVID-19 cases? And what are the recommendations that you have for them?
Right, and let's remember that the genome sequencing is a little delayed, so that means when they find cases in Region 6 and Region 10, we're talking about cases that were there about 4 weeks ago or maybe even longer. What that means is we don't know the current situation right now, but what we're seeing is that we did have a surge in Region 6 and in Region 10 several weeks ago, but now the number of cases have subsided in these regions. And right now what we're seeing are Ilocos, specifically in Lawag, it's having a surge. We're still seeing big numbers, high numbers in Mariveles, in Bataan. And then in Central Visayas, we're also seeing a spike in cases. So these are the areas that we're focused on right now. So, Davao City still has the most number of cases, but the trend has slowed down there. Same thing with Iloilo City and Bacolod and Cagayan de Oro. So we're still seeing high numbers in these areas in Mindanao and Visayas, but right now the current hotspots we would say are in these areas, like I mentioned. But we're also seeing a spike, as we mentioned, in Metro Manila, specifically in Makati and Manila. So cases increased quite a bit. Not very high increase, but a noticeable increase in cases, and that includes also Valenzuela and I believe a few other LGs in NCR.
All right, thank you so much for sharing the numbers with us and breaking them down. That was OCTA Research Fellow Professor Guido David over the phone. Thank you. And the Interior Department is eyeing changes in COVID-19 restrictions due to the threat of the Delta COVID variant. In today's Laging Handa briefing, Undersecretary Epimaco Dinsing said that they might recommend stricter measures on interzonal travel. Currently, some local governments allow travelers to enter using vaccination cards in lieu of RT-PCR test results.
Medyo sigurado po na magkakaroon ng higpitan ngayon at base po ito sa direktiba ng ating panggabi. Pero bago natin gawin ito, magkakaroon po tayo ng pakikipag-usap sa ating mga lokal na opisyales.
And in an interview with us here on One News Now, Undersecretary Martin Dino called on politicians and political parties to lead by example and avoid holding mass gatherings. Dino said the DILG will issue new directives soon to prevent such super spreader events from happening.
Siguro mas maganda na pangunahan ng mga politiko na tigil-tigilan na muna nila. Kung gusto nila wag nang pipila, wag nang magkaroon ng magti-trigger pa na kung saan magkakaroon tayo ng mass gathering.
To add to our woes, some areas in Cavite and Metro Manila may experience water service interruptions in the coming days as Maynila deals with high demand. Shaila Francisco with the details.
This carinderia in Imus, Cavite has no water supply since the pandemic started. Staff Marianne has no choice but to fetch water from a nearby deep well every day just to remain open.
Na lang po namin ma'am para isang hugasan na lang kasi nga ho yun nga ho yung ang hirap nga ho magbuhat ng tubig.
Meanwhile, a nearby household has to wait for the evening to store water for the next day. However, it doesn't last them until lunchtime, so they have to buy mineral water sometimes.
Yun nga ho ang problema. Hindi na ho, nagwiwisik-wisik na lang. Pahirapan nga ho, paligo ngayon eh. Sagana naman tayo sa ulan, may tubig naman. Ba tayo nila ibalik uli ang masaganang tubig?
Unfortunately, they may have to wait a little bit more for stable water supply. Around 44,000 customers of Maynilad and Imus, Cavite will be affected by 18 hours of water interruption until August 1. Some households will have no water supply from 6 a.m. to 12 midnight, while others will also experience service interruption from 9 a.m. to 10 p.m. Maynilad explained that this is due to the high demand amid the pandemic, as many residents are forced to stay inside their homes. Aside from residential areas, commercial accounts are competing with the demand as they have stopped filling up their water tanks at nighttime.
Nakakatulong yung dati. Kasi pag sa gabi kumukuha ng tubig, mas stable yung supply. By morning kasi hindi sila dumadagdag sa peak demand. Imus, this is a fringe area. Dulo siya ng ating concession at saka medyo elevated siya. So unfortunately, tuwing lumalakas ang demand sa water, ito yung mabilis na naapektuhan.
Around 45 barangays in some NCR cities will also have water interruption until 8 p.m. today and even until 1 a.m. on Wednesday in other areas. Maynilad is also asking customers to store 1 to 2 drums of water in case they will need to implement another round of water interruptions due to heavy rains. The water concessionaire explains the southwest monsoon can increase the turbidity of water entering their plants, which will take longer to treat.
In case lamang kailangan natin muli pagbaba ng produksyon, at tumaas ang turbidity, ay mayroon po silang magagamit na tubig.
To address the turbidity, Maynilad's treatment plants are undergoing upgrades which will be finished by 2022. The water concessionaire will also use modular treatment plants to source waters from the rivers of Cavite to augment supply. Shaila Francisco, we are One News.
Here are other stories we're keeping our eyes on. The PNP has ordered the Manila Police to keep a close eye on the Dolomite Beach along Manila Bay to avoid a repeat of last year's mass gatherings. PNP Chief Guillermo Eleazar said police officers should be deployed in the area to ensure that visitors will follow minimum health protocols. And the city of Manila has also received 18,000 doses of Johnson & Johnson's COVID-19 vaccines. The single-dose Janssen vaccines will only be administered to senior citizens and adults with comorbidities. More than 3 million doses of donated Johnson & Johnson's vaccines arrived in the Philippines last Friday. And a public health expert believes that the so-called Olympic bubble has already been broken. Kenji Shibuya, the former director of King's College London Institute for Population Health, said that the bubble system was broken after the first case was detected within the Olympic Village. Shibuya also warned of the possible clustering of COVID-19 infections within the Tokyo bubble. For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Masks on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.